So ngayong panahon, may dalawang uri na tayo ng medical consultation. We have in-person consultation and on the other side, we have telemedicine consultation. So ano bang pros and cons ng in-person consultation versus telemedicine consultation? So pag-usapan natin kung ano ba yung benefit nito, saan mas akma ito, at ano yung limitasyon ng dalawang uri ng consultation na to. Again, this is Doc Chris, your online family doctor, making medicine easy for you to have a healthy life.
For every home, a heart to guide. Filipino strength standing by your side. Through every mile, through every fight, your family's light burning bright. Family physicians give life a healthy life.
In-person consultation, nakikita ko yung pasyente with direct eye-to-eye contact. Nakakausap ko siya, nakakamusta ko siya, nakikita ko yung expressions niya. There are verbal and non-verbal cues na nakikita ko during our consultations. It's best that we can easily establish a rapport as a doctor and a patient. And at that time, makikita ko din na yung mga gestures niya that can be leading to some form of clues kung ano ba yung naramdaman niya during the time of his illness. No? Importante kasi yung rapport, especially in times of consultations, because the distress is the major factor na bakit siya nagpatingin sa'yo right now. May tendencies kasi ang mga Pilipino na pinapatagal nila yung sakit nila. And by looking at how the patient feels during the time of the first consult, and nakikita mo na parang hirap na siya, then you know how to attack. Kumbaga, your history taking in times of, let's say, paprioritize ko ba ito? Unahin ko ba yung ganitong types of questions? Whereas, if let's say, for example, we're talking to a patient that is teleconsult, let's say, for example, kausap ko sa computer by means of a Zoom or a platform, the difference there is there's a barrier. Itong screen na to is a barrier. A barrier that is limited by, number 1, connectivity, number 2, internet connection, number 3, kung blur yung image ng pasyente sa screen ng cellphone niya or sa screen ng tablet niya, masyadong malabo, hindi mo makakapag-provide ng more focus or clearer perspective kung ano yung nararamdaman ng pasyente. And then also, syempre, yung audio and compatibility niya dun sa, let's say, receiving end. Minsan kasi kapag pangit din yung earphones or headphones na nandun sa clinic, ano po yung sinabi nyo kanina, it lengthens the consultation and nagkakaroon tayo ng problem later on. Kaya mas mainam na if ever we have telehealth services, we have a good enough hardware, specifically a good headphones, a good microphone, a clear image of a camera, and even a clear image of a monitor or a computer. So those typical limitations are usually seen in telemedicine issues right now in modern medicine. Now sa in-person consultation, pag napapansin nyo, madali kayo makipag-usap sa pasyente and nagiging sabay na ang history taking and physical examination. May fluidity yung process and it saves much time in assessing patients na nakikita namin sa clinics. Mas marami kami nakikita ang pasyente kapag on the spot, yung history at the same time, ina-assess na namin siya. We auscultate the patient, we do assessment on bedside, and makakapag-provide pa kami ng additional management as well as paunang lunas sa mga pasyente natin. Whereas to comparison sa telemedicine, ang nagiging problema natin sa telemedicine is we have a barrier again, that is that the patient is remotely different from the location of the doctor. So dun sa situation na yon, history usually is the primary source of information sa pasyente, but we cannot do actual physical examination, or let's say yung physical examination mo is only limited to the extent na visual inspection lang. So kung ano yung nakikita or nasisilip lang ng camera, doon lang tayo nag-dwell, kumbaga, sa assessment natin sa pasyente. We cannot do the other important aspects of physical examination. We cannot do auscultation, we cannot do palpation, and we cannot do percussion. We cannot do maneuvers for our patient. Let's say if you want to assess a patient for appendicitis, we cannot do a McBurdy's point tenderness. We cannot assess for rebound tenderness unless we can instruct or may kasama sila sa bahay na health worker related na individual na alam niya, or let's say for example medical school yung background ng kasama nila sa office or sa work or sa bahay, mas makakatulong yun. Pero hindi lahat meron tayong ganong resources kumbaga sa management natin in telemedicine. So we will only rely primarily on the history of the patient, what the patient perceives, and hanggang dun lang. If let's say we could triage the patient, if kailangan siya mapunta sa emergency room for further evaluation, yun yung pinaka-best option, lalo na kung emergency yung case or urgent yung case na kailangan nila ng paunang lunas. Kasi kapag in person, nabibigay mo kung ano yung necessary na management agad-agad. Sa telemedicine, well, magtatanong ka pa kung saan ang available na hospital, saan ang available na ambulance na pwede mong puntahan or kontakin para sila ay mag-guide mo para pumunta kung saan sila dapat pupunta in that situation. Diba? So, maraming mga aspect ang nawawala in terms of telemedicine and in-person care. That is also important na kapag nagkakaroon tayo ng in-person care, we provide immediate management. Let's say for example, joint pain, o nagtatae siya, or nagkakaroon siya ng active GI symptoms, like nagkakaroon ng nausea or vomiting. Minsan nagbibigay na tayo ng IV or intradermal or intramuscular injection ng medication. So napakadaling gawin yun kasi na-assess natin yung pasyente at na-monitor natin yung pasyente. Compared to telemedicine, that also is kumbaga yung first aid natin, hindi natin na-provide agad-agad in telemedicine. So, medyo limited tayo doon. Ang pinaka-importante or pinaka-urgent na pwede natin magawa sa telemedicine is, ma'am, okay, if ever, based on our initial interview and assessment sa inyo by limited physical examination, I would suggest or recommend na you head to the nearest emergency room for a further evaluation of your current symptoms. Baka kasi kailangan mong ma-admit in your symptoms that if your symptoms progress in the upcoming months or in the upcoming hour of the consultation. So, yun ang mga limitations ng telemedicine. Now, kailan nagiging practical at nagiging useful ang in-person at saka telemedicine? Sa in-person, practical siya in first consult, at the same time, follow-up consult, and even shared medical appointments. Nagagawa natin yan face-to-face para nakikita natin, na-assess natin kung ano yung ina-assess natin yung pasyente directly, at saka na-establish natin yung full rapport sa ating pasyente. Compared to telemedicine, nakikita ko as a doctor, nakikita ko na yung telemedicine is more in line if you already saw the patient, meron ka nang na-establish rapport in an inpatient care or inpatient manner or outpatient care or outpatient manner. Let's say for example, nakita ko siya sa OPD, tapos minanage siya sa hypertension. Ang ginagawa ko na lang ngayon ay monitoring ng blood pressure. Imbis na pumunta siya in person sa OPD, we can advise the patient for follow-up by means of telemedicine para hindi na siya pumila sa OPD at nagkakaroon ng waiting time, lalo na maraming pasyente. So you could take advantage of telemedicine especially in continuity of care setting or follow-up consultation. So hanggang doon lang naman ang ko-compare natin sa in-person or face-to-face consultation versus telemedicine consultation. Both types of consultations are very important nowadays kasi ginagamit na yan in medical practice. But it's always important that as doctors know which will be appropriate in the scenario of our patients. So hanggang doon lang naman ang video ko for today. Hopefully may naintindihan kayo. If gusto mong patingin sa pasyente, if gusto nyo patingin sa doktor, you could do either in telemedicine or a face-to-face consultation. Those services are both available under my care if ever may gusto magpatingin. Pero syempre, that depends on the schedule of the doctor. Again, this is Doc Chris, your online family doctor, making medicine easy for you to have a healthy life.